I have read thousands of these scans, but this one made me stop and check the name at the top of the page twice. The arteries in front of me were smooth, clean, barely any calcium at all. If you had handed me this scan with no chart attached, I would have guessed the patient was 50, maybe 52. He is 82. I walked into the room and I told him what I was looking at. And then I asked him the question I ask every patient who surprises me. I said, "What have you been doing?" He smiled and he said, "Doctor, it's going to sound too simple." He was right. It did sound simple. But every single thing he told me that morning is backed by published research. And a few of them are things I have never heard a patient mention in 20 years of practice. So today I'm going to walk you through all 7. I'm also going to tell you exactly what is happening inside the artery wall when you do each one. Because once you understand the mechanism, you stop guessing.
Let me start with the one that genuinely surprised me, because it involves something sitting in almost every bathroom in America. He told me he had stopped using antiseptic mouthwash. Not stopped brushing, not stopped flossing, just stopped rinsing with the strong antibacterial kind. Now, when a patient tells me something like that, my first instinct is skepticism. But this one has real science behind it, and it is genuinely fascinating. Let me explain what is happening. On the surface of your tongue live colonies of bacteria that most people have never heard of. Their job is to take nitrate, which comes from the vegetables you eat, and convert it into nitrite. Your body then converts that nitrite into nitric oxide. Nitric oxide is one of the most important molecules in your entire cardiovascular system. It is the chemical signal that tells the smooth muscle in your artery walls to relax. When nitric oxide is plentiful, your vessels widen and your blood pressure falls.
When it is scarce, your vessels stay tight. Now here's the part that matters. Strong antibacterial mouthwash does not choose its targets. It kills the nitrate-converting bacteria along with everything else. In a study published in the American Journal of Hypertension in 2015, researchers gave antibacterial mouthwash to patients already being treated for high blood pressure. Their nitrate conversion dropped and their blood pressure rose. A separate 3-year study following adults in Puerto Rico found that the most frequent over-the-counter mouthwash users had a higher risk of developing hypertension. Now, please hear me carefully on this. I am not telling you to abandon oral hygiene. Gum health is critically important, and I will come back to that later in this video. Brush, floss, see your dentist. But if you are rinsing twice a day with a harsh antiseptic out of habit, that is a conversation worth having with your dentist. If you are finding this useful, let me know in the comments where you are watching from. I read them. Now let me give you the other half of that story. Because if those mouth bacteria are the factory, vegetables are the raw material. And in 2025, a team at the University of Exeter published a result that I think every older adult should know about. They recruited 36 adults in their 60s and 70s. They also recruited 39 adults under the age of 30. Both groups drank a concentrated nitrate-rich beetroot shot twice daily for 2 weeks. Then both groups drank an identical placebo with the nitrate removed. Here's what happened. The older adults saw their blood pressure fall by roughly 7 points. The younger adults saw no meaningful change at all. I want you to sit with that for a moment. The benefit appeared in the older group and not the younger one.
The researchers believe the reason is that our own natural nitric oxide production declines steadily with age, which means the dietary pathway becomes more important as we get older, not less. So what does that look like on a plate? Arugula has the highest nitrate content of any common vegetable, then spinach, then beets, celery, fennel, and lettuce. My patient was not drinking beetroot shots.
He was simply eating a serving of leafy greens with lunch most days. That is the entire intervention. Now, number 3 is about a piece of furniture. Researchers at Indiana University ran an experiment that changed how I talk to my patients about sitting. They had participants sit still for 3 hours while ultrasound measured the main artery in the leg. After 1 hour of sitting, that artery's ability to expand had dropped by as much as 50%. 1 hour. Let me explain why. Your arteries have an inner lining called the endothelium. That lining releases nitric oxide in response to blood flowing across it. The medical term is shear stress. When you sit motionless, your leg muscles stop pumping. Blood pools, flow slows, and that signal fades. The lining simply stops getting the message. Then the researchers repeated the experiment. Same people, same 3 hours, but this time they walked slowly for 5 minutes each hour. 2 miles per hour, a gentle stroll. And their arterial function did not decline at all. It held steady for the full 3 hours. So the instruction I now give every patient is this. Once an hour, stand up and move for 5 minutes. Walk to the mailbox. Water the plants. Walk the hallway while the coffee brews. You are not exercising. You are keeping a signal alive. Now, I want to be honest with you about something because I do not believe in overselling.
Dr. Benjamin Levine at the University of Texas ran a 2-year exercise trial and found that middle-aged hearts became measurably more elastic again. But when his team tried a similar approach in adults over 65, the heart muscle itself did not remodel the same way. Some structural stiffening appears to become permanent. So, I am not going to promise you a 20-year reversal. What that same body of research does show is that after 65, exercise still improves blood vessel function, autonomic regulation, and oxygen capacity. Those are not small things. Those are the things that determine whether you can climb your own stairs at 90. Number 4 is sleep. In 2019, a Spanish study called PESA published in the Journal of the American College of Cardiology. Nearly 4,000 participants wore motion trackers for 7 consecutive nights. Then, every one of them had ultrasound and CT imaging of their arteries. Those sleeping less than 6 hours per night had 27% more plaque throughout the body. That was after adjusting for smoking, cholesterol, weight, and blood pressure. And it was not only about total hours. Participants with fragmented, restless sleep also showed more plaque, independent of duration. Short sleep drives inflammation, raises overnight blood pressure, and worsens glucose handling. All 3 of those damage the artery lining. Number 5 is heat. And I want you to hear my caution before you hear the finding. In Finland, researchers followed 2,315 men for over 20 years. Compared with men who used a sauna once weekly, those using it 4 to 7 times weekly had roughly 50% lower cardiovascular death. Sudden cardiac death was 63% lower. All-cause mortality was 40% lower. Now, as a physician, I have to tell you plainly that this is observational data. It cannot prove cause and effect, and healthier men may simply have used the sauna more often. More importantly, heat exposure carries real risk for some older adults. If you take blood pressure medication or a diuretic, or if you have aortic stenosis or unstable heart disease, please do not start this without speaking to your own physician. For many of my patients, a warm bath a few evenings a week is the reasonable version. Number 6 brings us back to the mouth, exactly as I promised. In 2007, the New England Journal of Medicine published a trial of 120 patients with severe gum disease. Half received standard dental care. Half received intensive periodontal treatment. 6 months later, the intensively treated group had measurably better artery function. Treating the gums improved the blood vessels. Chronic gum inflammation puts bacteria and inflammatory signals directly into the bloodstream.
Your arteries are downstream of your mouth.
Which is why I ask about dental visits in a cardiology appointment, and why some patients look at me strangely when I do. And the seventh is not a habit at all. It is a place. In 2017, the Lancet published the results of CT scans on 705 members of the Chimani, an indigenous group in the Bolivian Amazon. The findings stunned the cardiology world. The Chimani have the lowest levels of coronary artery disease ever recorded in any population on Earth. Among those over 75, 65% had zero coronary calcium. Zero, at an average age of 81. For comparison, an American man's likelihood of having calcium in his coronary arteries is roughly equal to his age in years. And this is not a genetic advantage. The Chimani carry a heavy burden of parasitic infection and chronic inflammation.
What they have instead is a lifetime of low LDL cholesterol, low blood pressure, normal blood sugar, no tobacco, and constant ordinary movement all day long. The authors concluded that coronary atherosclerosis is avoidable in most people. Not with a supplement, not with a procedure, with a life. Now, before I let you go, I need to say 4 things clearly. One patient scan is not proof of anything, and I would never present it as such. Genetics, family history, and lipoprotein a all matter. And some of my healthiest patients still develop disease. My patient never stopped a single medication I prescribed, and neither should you. And this video is education, not medical advice. I am a physician, but I am not your physician. Please talk to your own doctor before you change anything, particularly the heat exposure and the exercise. But here is what 20 years of reading these scans has taught me. Arteries are not a calendar.
They do not simply count your birthdays and harden on schedule. They respond to what you do every single day for as long as you are alive to do it. My 82-year-old patient learned that in his 60s. There is still time for you. Tell me in the comments which of the 7 surprised you most. I suspect it was the mouthwash. Take care of yourselves, and I will see you in the next one.